Chinese knot stitch technique, a simple technique for arthroscopic biceps tenodesis. The patient is placed in the left lateral decubitus position. The posterior portal E, anterior portal A, anterolateral portal B, and posterolateral portal D are established on the right shoulder. Viewing from the posterior portal to the glenohumeral joint, the arthroscopic examination reveals significant tendinosis and dislocation of the proximal biceps tendon in this case. From the posterolateral view, the location of the long head of biceps tendon is confirmed by gently probing between the greater tuberosity and the lesser tuberosity. Via the anterolateral portal, the transverse humeral ligament is carefully removed using a radiofrequency ablator along the axis of intertubercular groove until the LHBT is clearly exposed. The anterolateral portal is used to introduce a suture saddle, which passes a number serial prolane suture underneath the biceps tendon. This helps guide the passage of a number to ethibond XL polyester suture through the bottom of the biceps tendon. The biceps tendon is punctured using a suture saddle through the anterolateral portal, and the number serial prolane suture is passed through its center. After pulling both the prolane suture and the middle section of the ethibond suture out from the anterolateral portal, they are tied together. The prolane suture is used as a guide to pass the middle section of the ethibond suture through the center of the biceps tendon, creating a loop above it. The free ends and the loop are pulled out from the cannula in the anterolateral portal, and then the two free ends are drawn through the loop and tightened alternately, creating a Chinese knot. The arthroscopic view shifts to the glenohumeral joint, and the proximal biceps tendon is detached from its supraglenoid attachment using a radiofrequency ablator. The arthroscopic view returns to the subacromial space via the posterolateral portal. A radiofrequency ablator is imported to abride any remaining soft tissue within the basilar groove. The bone surface at the tenodesis site is decorticated using an arthroscopic shaver through the anterolateral portal. Subsequently, a bone tunnel is created with an awl. The two free ends are inserted into a footprint ultrasuture anchor, which is then implanted into the bone tunnel using a hammer through the anterolateral portal. An awl is used to compress the suture anchor in case of pullout. Any remaining suture tails are trimmed above the anchor. The proximal stump of the biceps tendon is transected using an arthroscopic ablator.